Yeah,
All right,
okay.
Dr. Tahsin, it's really nice to have you in our meeting tonight. So here you are going to share your own experience. I'm not going to take too much time for delaying you. And you can start with from which country you are from, when you have given your part A,
Mm.
how much time you have taken for part B preparation, what were the tricks that you have followed, and all that stuff, whatever you want to say. Okay, this is your time, this is your success story. So go for it.
So how many minutes am I getting for this?
Yeah, it's fine. Take your whole time, no problem.
Okay, I'm Dr.
Dr.
Tahsin.
Tahsin, Dr.
Yeah.
Tahsin, you will get 10 minutes and after 6 minutes you will hear a bell.
Okay. Okay. So, I'm from Bangladesh.
Mhm,
And at first, so I start with my part A. I appeared in my part A examination in September 2022.
mhm,
So after that, I passed on my first attempt. And after that, I took some time because my baby was very small. And it was not possible for me to take care of my baby job and study side by side because he was very small.
mhm,
So I decided to take some time for Part B. And finally, I booked my Part B examination in this March for the August. And actually, I was called by Dr. Shikila.
mhm,
She was saying, Apu, the booking window is open. So
mhm,
let's book the exam. So I was just saying, at first I told her, no, it's too early for me. I want to take some more time for
mhm,
Part B. But then I thought, no, I think I can. I'm ready to prepare for this exam and sit for the exam. It's time to take preparation for Part B. So I booked the exam, and after booking my exam, I joined your course.
mhm.
And it was also suggested by Dr. Shikila.
All right. Thanks to Dr. Cyril as well then. All
so,
right.
uh, so when I joined your course, I was in the middle. Yeah, probably I got the last 10 sessions of critical care, and then
Yes,
it was
I can recall that.
continuous.
Yeah. Yeah.
So the anatomy was untouched for me. I was
Mm,
very afraid, I
mm,
told you at that time because anatomy carries a lot of marks and those
yeah.
are solid marks.
Yes.
And also critical care among the 42, 43 stations, I only got 10. So I was
Mhm.
very worried if I could cover all of them in time. But luckily, uh, by your help, I could finish the entire syllabus.
It
But
wasn't
it
my
was,
help. It was all your hard work. Tell all the persons that is going to hear about your journey, how much hard work you have put into this.
so I started taking preparation towards the end of March,
Okay.
middle to end of March.
Hmm.
My
And your
exam was in
exam was
August.
in August, right? Okay. So
August. It
it
was
was
5 months
5 months, right?
around.
Right. Hmm.
But actually, I could not study that much every day,
Hmm.
as you
Hmm.
know, because my workplace is too far from my home
Correct.
and I had to travel a lot.
Hmm.
So in the morning, it usually takes 2 hours. And when I return home, it takes 2 to 3 hours.
Right.
And unfortunately, I have motion sickness.
Hmm.
So it was very difficult for me in the beginning. I was
Right.
wondering what should I do because I have a toddler to deal with at home.
Mm.
And so when should I study? So I decided that whatever it takes, how bad I feel, I should not waste time. Because if I reach home, I cannot study. I have to take care of my child and also spend some time with him.
Right.
So I took my preparation in the journey.
Yeah, that
The
was
entire
brilliant.
time.
Once I get to know about that, I was thinking like, how could you do that? Like even in a journey and put all of those focus in the like study materials and the class recordings and all that stuff. Also attending the live sessions, attending the live mocks. It was brilliant.
So
Truly,
I
it
had
was
a trick.
brilliant. Hmm.
The trick was when I attended your mocks or sessions, I handed over my baby to my parents or my husband.
Hmm.
So I told them that I have sessions every day.
Okay.
So I got extra time
Right.
to study
Right.
at that time. So, for example, if you have session today, uh, we don't have session tomorrow. But I
Correct.
used to say that I have a session, please take care of him. So I go to another room to study.
Right.
That's what I did. And one thing I tried to maintain, I attended all the mocks.
Hmm. Yeah, I can
I
recall
did,
that. You were always you were there, like raising the hands in the very first place. In case of all the mocks, it was very good. Even though, like,
yeah, so-
if you can remember, like I have taken some of the grand anatomy mocks, right?
yeah, yeah,
And
yeah.
you are being frightened, like what I'm going to do because I didn't finish any of those anatomy, right? And you were attending and you were doing excellent as well for those things. It was commendable. Very nice.
So my target was to pass the exam.
Right. Hmm.
So I thought the very first mock I attended was the cervical spine fracture
Hmm.
of critical care, and it was horrible.
Yeah.
I could recall. So after that, I thought I'm not going to attend the mocks. But then I thought if I give up attending mocks, then
Hmm.
I'll find new excuses every day not to attend
Correct.
mocks.
True. True. Very
So
true.
so whatever it takes, even if I have a bad preparation, I should attend the mocks. I should speak up. I should say
Right.
something. So
Always.
otherwise,
Yes.
yeah, always. Otherwise, I cannot overcome the fear.
Correct.
So
Correct.
that's what I try to maintain. I try to attend all the mocks
Yes.
because I had no one to speak to
Practice with,
because
yeah.
I'm not, yeah. I have a reading partner, Shitila, but she's
Yeah.
too busy because she's also in a tertiary medical college hospital. But
Even after she passed her exam, she didn't give me any text. She didn't give me any call. I get to know about her result from you. Okay. So yeah, that was
she's
it.
so
Like,
busy.
Actually. Mm.
So what I did is I studied the knowledge part by myself, but I
mhm,
tried to practice the skill part with Shitila whenever she could.
mm,
It would have been easier for me if I worked in a tertiary level hospital, but
true,
I'm working
true.
in the village area, so that's why I faced some problems.
Right.
But towards the end, for the last 1 month, I uh, I studied. I tried to maintain 6 to 7 hours,
Okay.
um, and for in the last 1 week, oh, I took a leave of 10 days from my
Hmm.
office head.
Hmm.
But after taking the leave, I was thinking, why have I taken the leave? Because now I don't have any journey.
Yeah.
And if I stay at home, my child will come to me, and that will waste some time,
True.
you know,
True.
unfortunately, because I can understand that it's a bit emotional
Mm.
with a child. But if I give time to my child before my exam, then I cannot study.
True. True.
So a week before my exam, Shikila and I started practicing all the sessions.
Hmm.
And 3 days before the exam, we studied all the rest of the things by ourselves. So
Right.
I thought that the anatomy part I'll study before the day of my exam.
Hmm.
The revision and critical care the second last day before my exam,
Hmm.
and pathology the third day before my exam.
Right.
So, and on the day of the exam, I did not do anything. I just ate a good amount of breakfast,
Good.
and then
Good. That's
I
what I
went.
said. Like you cannot study this the day before your exam. It's like horrible day, right? So you cannot study on those days.
I was very embarrassed, because
Right.
Shithila and I were in the same room, and she
Mhm.
was drowning in books, and I was just scrolling my phone.
Phones, yeah.
I was watching YouTube
Right.
songs
She
or
was
anything else. Yeah,
she
what?
was completely done. You were completely done. Like within the evening the day before the our examination, and
That's what I
I had
said,
the
Dr.
critical
Shitila. That's what I said. Like
exam.
you need to stop your study the day before your exam from the evening. Then you just enjoy your life. You know.
Yeah, she was like the dreamy dreamy examinee. I will
Right.
never
No,
able.
I was just telling her, what are you studying so much?
Yeah.
And she was, I think she slept only 2 or 3 hours on the day of on the night of the exam. I went to sleep at 12 maybe, but then unfortunately our AC was not working in the hotel. I don't know why. It's a five-star hotel, but that happened with us. And
It's just a bad
then
luck.
bad luck, yeah. We informed the hotel management. They came and they did something. It was working. Then again, it went out of order. Then I
Right.
went to sleep, and she was sweating. She couldn't sleep, but I
Mm.
slept. I had a sound sleep,
Good.
and on
That's
the day
very
of the
important.
exam,
Rest just before the exam. Having a good sleep is very important for a good exam.
yeah. So that's
All
all.
right.
And
So if anyone knows, I don't know whether you know, guys, or not, Dr. Tahsin got 273, right? Am I correct? Yeah. Yes.
yes,
So
yes.
it's too much. It's too much of score that
It's not
she
too
got.
much.
But
You have,
I have predicted that. Okay. Once I get to know about her exam, so we talked, and she has told me about all the stations, a little bit of like for all the questions that has been asked and all that's how she answer. I know the way she talks, the way she express, the way she do the clinical examination thanks to the IMG workshop for 4 days. I know
yes, yes,
how she
yes.
works, right? So I said like, okay, see, the exams that you have given, nearly you are going to get at least 275 to 265. There is a range that I have given. Am I correct, Dr. Tasin? Yeah. So
Yes.
she got 273. That's brilliant, Dr. Tasin. And I'm really, really, really happy because you get that mark. Okay. I'm really, really, really happy
My
about
luck is so bad because I bought a pair of shoes, loafer,
that.
for my
Mm-hmm.
exam.
Mm.
And I went to the center. I walked for a while, and my it do you know what happened? Shitila knows. Shitila,
She started bleeding.
It's
She had
horrible.
a
yeah,
It's horrible.
it was
because
horrible.
it was a new shoe. It was a
Mm.
new shoe, and I
Yeah.
did not
And you
walk
weren't
with
used to
it
with that. Yeah.
previously. Yeah,
Yeah.
I was not used to with that. So I was asking the RCS invigilators or the staff there, can you
Mm. For
please
first
give me a
aids.
bandage? Yeah,
Yeah. Mm.
first aid because
Good.
I couldn't walk properly.
Mm. That was horrible.
And that was horrible. It was bleeding so much. And after that, my first station was a critical care station. It
Yeah.
started with the knowledge part. So they
Mm.
divided into two halves. So I was in one half and Shitila was in another half.
Mm-hmm.
The first half had 10 stations. And the
Okay.
second half, along with the rest stations, there
Rest
were nine
station.
stations.
9 stations.
Yeah.
Yeah. Mm-hmm.
So in the first half, my pathology septic arthritis station was not at all good.
Mm.
It was
And
not
you
at
were
all good.
frightened with that.
Yeah,
Mm.
I knew how much I got. I saw it, maybe 12 or
Mm.
13.
Right.
So then it started with the skill part. And in the skill part, from the very beginning, I was not feeling well. I don't know why.
Mm.
Maybe I want to warn all other examinees, and even the RCS examiner also warned in the very beginning. But I thought, uh, I didn't think that something like that would happen. Regarding washing hands, they kept alcohol. So I took a lot of alcohol in each and
Okay.
every stations, and I think the smell of alcohol made me nauseated.
Okay. All right.
So, and it was absolutely unnecessary to take so much of alcohol because the sanitizer
You can
was
just simply act, you can just simply act that you are
yeah,
washing your hand. Even the
yes,
RCS director is going to mention, like, you don't need to put out too much of liquids on your hand
yeah,
because it will be sticky, right? So you cannot wear the
yes.
gloves properly in case of the postural skills. So just simply you are just acting that you are washing your hand, and that's enough.
He exactly said this before starting our exam that
Right.
don't take too much of alcohol so that
Right.
you become nauseous.
Yeah.
Exactly that happened to me, and I didn't think about it. So in the last session, the procedure session, I was my head was
Completely
spinning.
lost.
I was completely lost, and
Right.
I did not perform most of the steps of 10 steps approach. So I was very, I don't know what happened. I was
See,
totally lost.
at the end, you got 273 and you passed this exam with a very high marks, right? So Alhamdulillah with
Yeah,
that,
yeah.
right? It was very nice. All right.
Alhamdulillah.
Brilliant story from you. So, what are the tips you want to give to the future candidates who wants to give their exam in near future, or they wants to prepare themselves? What are the tips and tricks that you want to give for them? Any specific
Okay.
things?
So, yeah, I think I just want to say stick to the routine because honestly, I did not follow any other course other than IMG.
Yeah.
I was totally dependent on your study materials and also the
And
classes
also one thing I
and,
just want to
and
add that
also the workshop.
you are not concerned about, like, there are lots of other groups, right? And there are lots of things are floating around, right? So you are
Yeah,
not
yeah.
worried about all of those things. The most of the
No,
candidates are worried about all of those things. Okay, what will happen for
see,
this? What is the
exactly.
answer of this? And I just clearly said,
No,
don't go for those things, right?
frankly,
Yeah.
I didn't have that much of time
Yeah, good.
thinking
That
about
was good.
other
You need to be
study
focused
materials.
on
Yeah.
whatever you have, right? And practice well. Good job. Okay. Yeah. Then.
So, and I think there's no need to study 8 hours, 9 hours. Most of the candidates ask how many hours
Hmm,
to study
hmm,
every day.
hmm.
I think you should be consistent. You should study every day,
Right.
regularly,
Yes.
even if it's half an hour.
Right.
But
It's all about
there should
mindset.
not
You are
be,
setting your mind for this exam.
yeah, yeah, yeah. So that there is no gap.
Correct.
And be committed to giving mocks. Mocks are
Yes.
really important, I think.
Very important. Yes.
And
Yes.
listen to the class recordings whenever you can. I used to listen to the class recordings during my journey, and I also thought like during how to say this. Okay, I'm saying this. Some may think I'm silly. So I am a stationery freak. I bought a lot of highlighters and sticky notes. So during your
Yeah.
classes, I used to utilize those, so that it makes me want to read the books all the time.
Yeah. 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 It's a good
Full of
approach. Yes.
colors. Yeah, full of colors. So do whatever that makes you want to study.
Correct. Yes. Good.
Yeah. So it might
That was
seem
brilliant.
silly.
Excellent. No, it's not silly. Like, it's the way you study, right? It's like
Yeah, no,
different people
it may be
will
a bit,
follow different
yeah,
approach.
it may be a bit childish,
No,
but
it's not. Like, everyone has their own style of studying, right? Someone cannot even study from the books, like Dr. Samir. Okay, he never ever read from the books. He was just only on my class recordings, and that's it, right? So it's a different approach for different candidates, right? And that's why the success stories are like so fascinating to hear from different candidates, because they are following different routes. They're preparing themselves in a different ways, right? These are different stories, and that's why it's brilliant. All right, very nice, Dr. Tahsin. Anyone wants to ask any queries or any questions regarding the preparation, or any whatever the questions could be? Anyone is there wants to ask anything to Dr. Tahsin? See, there is a problem, right? People really fear of talking and communicating, right? Do you want to talk about something like that?
Hello, I am Dr.
Welcome,
Samiha, and
brilliant, Dr.
hello, Dr.
Samiha.
Tahsin,
Yes,
and
So
a lot of congratulations to you for your success. And I want to
thank
ask you
you.
one thing that how can I improve my skill part? And it is so much important to pass my exam. As knowledge part is easy because it is only to memorize
knowledge part is easy.
things.
Remember that, okay?
It is easy to memorize called
No, I don't think knowledge is easy or skill is easy because some of the candidates also failed in knowledge and they were
Yeah.
pretty good.
Yeah.
So there's no need to underestimate any of the segments.
No, I don't underestimate anything, but it is easy for me to for the knowledge part that I can easily memorize it, and
Right.
also I could
She can
answer
grasp
all.
easily.
But
I know because
in
I've
skill
heard
part,
her mock and she's excellent.
but for the skill part, sometimes some of the steps will be missed in exams, or also in last yesterday mock I also missed some points, so it will lose some marks. So it is important to memorize all those things and to score excellent in the exam. So how can we improve our skill part?
It's only practice. You have to practice a lot. What I used to do is each time I practiced, I used to remember what I missed and I used to write it down in a diary. So that the next time I used to compare that the number of points I've missed have decreased or increased.
Yes.
So you can track that, right? For
Yes.
example, you are performing the thyroid station like you did yesterday. So if you miss a point, like Atik Bhai is saying that it was excellent, but you missed this point. So you can write it in your diary and you can mark yourself out of 10. So next time when you practice yourself, you have to see whether you are missing that point or there's a new point. It will help you remember that you are missing a particular point. Okay.
How many times you practice the skill part?
I don't know. Actually, it's
More than 10, Dr. Samiha, at least more than 10. That's for sure.
no, not more than 10. It's not about how many times I did. I was targeting the mocks all the time.
Yes, I also. I didn't
So
ever any eager to study, but for the mock, I have to study.
yeah. Take the mock seriously, and I think you'll pass. Obviously pass, because you are doing great. I've seen your mocks.
Okay, thank you for your appreciation.
Thank you.
All right, Dr. Zahin wanted to ask something, I guess. Dr. Zahin, can you unmute yourself and can talk? Dr. Zahin said, like, can we prep for 6 or 7 months while doing a job?
Definitely, because I'm also doing a job, and it was 5 months duration.
Right.
So definitely.
Right. Any other queries, please?
It depends upon how much committed you are and how much time you are being able to give to your study rather
Right.
than side-by-side working. So if you cannot, so if you are working 24 hours a day, for example, you are going at 8 a.m. one day, coming back to 2 p.m. next day, study 5 days a week. If we are deducting these 2 days, in that case, you have to study 5 days, more in those 5 days. That's it.
All right. So any other person wants to ask anything to Dr. Tahsin?
Hi, I'm Dr. Sumaya. I
Hello.
just wanted to ask if were you able to answer most of the questions in the knowledge stations? I mean,
No. Actually, frankly speaking, I missed 2 or 3 questions in each and every station. And
That's pretty normal.
and one thing I should have done, most of them did. They guessed, but I did not guess. I told them that I would like to come back to this question later on. They asked me the questions in the end, but I did not answer anything. So it was absolutely yes or no type situation. That I'm answering. If I can't, I won't guess. So in each and every sessions, I missed 2 or 3 questions. And in the pathology septic arthritis station, there were so many questions that I missed. And actually, it's not missed. The questions are common, but the points, they don't count those points. They will be saying what else. Okay. So I was answering, but they were asking anything else. That means in the checklist or in the answer sheet, it was not there.
Okay.
That's
Okay.
it.
Thank you so much.
All right, thank
Welcome.
you for your question, Dr. Sumaya. Dr. Imran wants to ask something. Dr. Imran.
So I passed this brilliant result. I want to know how many times to revise knowledge part. How many
Actually,
revise this knowledge part?
I did not count how many times I did, but not many times because I attended the mocks only. So it's pretty countable, like 3 times or 4 times.
And before
Okay,
your exam, at least you have given one revision as well, right?
Yeah.
So at least
So
you have
4,
given
5
at least
times.
five times of revisions. At least that is,
Yeah.
I always say to all of the candidates, at least you need to go for at least 5. Like 4 times you are going to get from the course, and 1 time by yourself just before the exam.
Yes. And also QRC. QRC was very helpful.
Yeah.
I have
The
another
quick
question.
revision tools.
I have another question, please.
Yes.
May I?
Yeah.
Yes,
Go ahead,
surely.
Dr. Imran.
Okay. How many days before the exam I have to go on the center to
cope up?
anxious to
To?
Kuala Lumpur, right?
You mean how many days before your exam you have
Yes.
to
I
fly
have
to
to go.
Kuala Lumpur?
Yes.
No. Yeah, okay.
Okay. So we did only 1 day before our exam, and we were very much, it was hectic. I think it should be at least 2 days before your exam. Our exam was on 19th, and we flew to Kuala Lumpur on 17th of August.
Okay, thank you.
But too much time is not needed because, it's a foreign country. You will feel like roaming around, going to the shops for shopping. And food is also a factor. Not everyone can adjust with the food.
Okay. Thank you.
All right. Anyone else wants to ask anything? No one. All right. So your last words, Dr. Tahsin. It was a brilliant
Last
journey.
word.
Any
Thank
last
you
words
so much.
You're welcome.
What else?
You always have the
No,
doubts,
because
right? For passing this exam.
I knew I would pass.
Good. Yes, that's the spirit. Brilliant. But you wanted to be like, a topper type. Like, you are a perfectionist. So you wanted to top in this exam. So that's why you are doing like so much of
I
hard
think,
works before your exam.
no, all I want to say is we should keep our expectations low
Yes.
because you never know.
Yes.
I thought that I will pass. Maybe I'll pass, inshallah. But there is something called luck too.
True.
And we are never sure until we have the results in our hand, until we see for ourselves. So it's
Correct.
better to say it was not a good exam.
But at least, alhamdulillah, whatever you get, right?
Yes,
with that.
yes.
Yes, alhamdulillah.
Yes,
It was
alhamdulillah.
brilliant.
No, I was
Yes,
saying after giving the exams, we should keep our expectations low.
correct.
In
Yes.
that case, even if we secure less marks, then
Hmm.
we will be pleased with it.
Yes.
That's
Yes.
right.
All right.
Thank you.
Finally, congratulations, Dr. Tahsin, for your brilliant
you.
result. And hopefully you will endeavor more in your future surgical career. Okay. It was brilliant
That's
journey.
right.
And I hope you are going to help all the future IMG candidates and whoever is going to take any support, if they are going to seek any support, please help them. Okay. You are a brilliant student, so try to help them as well. That will be my request on behalf of all the
Yes,
other
of
candidates.
course.
Okay.
Many of the candidates knocked me, but because of my foundation training here, I couldn't answer them. So I told some of them that we have a session today.
Yeah.
There I will brief, and other candidates who passed will also
Yeah.
brief there.
Right.
So
Right. But
probably
still,
they
like,
have joined.
there are so many queries for the future candidates, right? Maybe they are going to put those things into the group, or they can give you some of the personal text and like
Yes,
what's
yes.
not. So just try to help them as much as possible. Okay.
Okay, thank
All
you.
right. Okay, Dr. Tahsin. Thank you so much for your time.